Uh, Dear guests and dear presenters of our workshop today, on behalf of the partners of BETTEReHEALTH project, I would like to welcome you to our first international workshop. We've done several regional workshops, including can also be considered as international since they include international participation. But this is our first combining all the regional hubs and partners of the project. Thank you for finding the time to prioritize our meeting today amid other activities and despite being a digital event. We hope that it will be a fruitful event that will give both you and us inspiration to work further for improving eHealth policy across African countries. And through better eHealth policy, we hope also that we will be improving health. As you might already know, BETTEReHEALTH aims in increasing the level of international collaboration and cooperation in health, but also to inform and strengthen stakeholders in making the right decisions for the successful implementation of eHealth. And it is you, the stakeholders of eHealth, that it is the purpose that we organize this event today. Therefore, we ask you to actively participate in our discussions and help us understand better your opinions and your needs. This event is also an important milestone for our project. This workshop is closing the first year of our activities and stressfully enough leaves us with only one more year again. We've done a lot, our partners have done a lot, have worked hard in difficult conditions, but also we are left with a lot to do. And new ideas for new activities are also rising. Even the fact that we did not get to organize this meeting as a physical meeting as we intend to do, inspired us to think of new formats to disseminate and discuss our project. For example, we hope that next year we will have more regular online events to meet you more often and with more time to interact. We are very aware that for our project to be successful, we need your help. We need you to tell us your opinions and your needs. Some of you might have noticed that we depend so much on your opinions and your feedback that we bother you maybe a bit more than your busy workday would allow us to do. But we are very eager to find out what is the situation, describe it, document it, and distill knowledge out of this. Thank you for this. Thank you for what you have given us until now. And we hope we will continue collaborate, and we hope that you understand our motivation for asking your feedback so often. If you haven't done it already, we would suggest that you subscribe to our newsletter and follow our project in Twitter and LinkedIn, but also don't hesitate to send us emails and ask for meetings with us, and to use these channels and today's event to let us know your opinion. Thank you once more for joining today. I'm looking forward for interesting discussions, and now I would like to invite Frederic to present the project and the structure of the program. Thank you very much for joining us.
Thank you very much, Kostas, for your introductions to this event. Yeah, I would just like to continue with a brief overview of the project itself, Better eHealth, for those of you who are not yet fully acquainted with the project or aware of what we're doing exactly. So as you saw in the previous slide, Better eHealth is indeed looking at a number of factors that are important for eHealth use and implementation related to human factors, to technical factors, and importantly also policy factors. So those are the topics that we are dealing with, but also, as you can see here, boosting the international cooperation, mainly within Africa and also between Europe and Africa, but we're not sort of limited to that. And then we're also very much open to collaborations and input from outside of those two continents. But the project is indeed about better knowledge and better implementation of eHealth in African countries, obviously ultimately for better health outcomes in the continent. And Better eHealth, as was mentioned, is an EU-funded project. It is a coordination and support action, so we're not developing anything ourselves in the sense of technologies and so on, but rather we are coordinating and supporting what is already out there, and we are working together and trying to work together with the various stakeholders in the field in order to come to that better knowledge of or around eHealth and increasing international collaboration so that we can learn from each other. The stakeholders in the field can learn from good practice that is already out there, either within other African countries, but also, let's say, experience from Europe that can be translated to Africa, and even vice versa, because we know that on the African continent, also for many years, a lot of interesting developments have been built up. So you can see here that we're looking and working with end user communities, being the health professionals, health organizations, and so on, but also policymakers, because policy around eHealth and regulation is necessary and is important. And also at that level, there are already a lot of initiatives going on. So again, good practice and experience can be learned from those existing policy or regulation implementations. And as I said, the E in eHealth and the digital in digital health and the tele in telehealth are really only tools ultimately to support better health provision, health education, and health outcomes for the entire population. So we're very much aware of that eHealth in itself is not the goal, but is rather a tool, as I think most of us will know and will recognize, because in the end it is about the health of citizens, health of the population. And with the entire project, we indeed want to create increased opportunities for collaboration, but also for better knowledge among different stakeholders in Africa and Europe. Here you can see the different partners that are directly involved in the project. We have partners in 4 African countries: Tunisia, Ethiopia, Ghana, and Malawi. The project coordinator is SINTEF in Norway, and Antypas is the project coordinator for SINTEF. And then we also have a few other partners in Norway, one in Holland, and I myself am part of a Belgian company, Lievens-Lanckman. So these are the partners, but obviously our network expands far beyond this. We need to collaborate with all of you in this meeting and with many more. These are some of the specific activities that we have been doing and that we will continue to do throughout the next year of the project. And as I said before, you can see here a number of these things like human factors, technical factors, public policy, guidelines and regulation factors. There we're on the one hand looking at and studying what is out there, but from there then drawing certain conclusions and making or trying to make certain recommendations as to what are some of the necessary things to do in order to implement eHealth usefully and successfully. And one of the important things that we're doing is establishing, or we have established, regional hubs through those partners in the 4 African countries that we have within the project. They are working within their own regions of Northern Africa, West Africa, East and Central Africa, and then Southern Africa, bringing together, let's say at a more direct level and at a smaller scale, bringing together the stakeholders within those regions through regional workshops, but also through a lot of online communication and collaboration in order within that region to share and compare what is happening. And then obviously also from there across the different regions and with partners and stakeholders in Europe to also bring all that information and all that knowledge together in order to move our project's agenda further, but obviously to move the, let's say, the more global eHealth aims and agenda forward. This is a schematic representation of what was basically in the previous slide, where you can see some of the specific work packages that are part of the project, and where again you see these different factors and items coming back in terms of human factors, which is dealing with capacity building, training, empowerment of health professionals, but also of patients and citizens. The technical factors, where we have been looking at interoperability, also a topic that will come up later today, standardization, technical infrastructures, and then public policy, which has to do with the legal and regulatory issues that are being set up by governments nationally, regionally, locally, and so on, and also developing roadmaps as to how eHealth can be implemented at those national levels. This just shows you what I was mentioning before about the regional hubs. So you can see the countries in red. That's where we have our project partners who are leading those hubs, and then you see the different countries that are each time part of one of the hubs. And we'll actually have a lot of our partners from these countries and from these institutions who will be talking later today and also tomorrow around some of the things that they have been working on in the past and or are currently still working on. So that's going to be a very exciting part of our program today and tomorrow. With that, I would just like to encourage all participants to indeed join our hubs based on the country where you are, but also if you are from outside of Africa to get in touch with us so that we can make sure that we involve you in our further project work. And we will also have regular meetings, or actually regular webinars starting as of January, where we will address certain topics or bring together certain panels. Like, for instance, we already are planning something on a policy panel, a ministerial panel, where we will have representatives from ministries in different countries to present and also to discuss what they are doing, how they are regulating, how they are implementing eHealth and so forth. But there will be, about every month a different topic or a different stakeholder group that will be featured at these events. So we will obviously keep all of you informed about this and hope we can collaborate very actively with you on these events. This is where you can find us, and obviously for today's and tomorrow's meeting, we encourage you to also share your own information and thoughts from this meeting over Twitter, over LinkedIn, and other social media. You can tag us at BettereHealth and also use the hashtag BettereHealth so that people can easily find the information. And with that, I conclude my presentation, I'm just looking at our panelists, whether Salim has already joined. Not yet. I see. I think he was saying he might be a few minutes late. We have Salim from the WHO Digital Health Atlas, who will be presenting next. And then the program continues with a look at some of the policy and regulatory aspects presented by two of our partners in Ethiopia and from the Ghana Health Service in Ghana. Then we have a short break after that, just to stretch our legs or refresh our cup of coffee or tea. We continue with a few presentations around technical aspects and some practical health information systems that have already been put into place in various countries. After that, we're looking at some human factors and sustainable, trustable eHealth solutions. This is an important topic. We'll actually also have a presentation about some eHealth programs and implementations that have been done in Norway. As I mentioned before, we are indeed within this project also looking at exchanges between Europe and Africa in order to learn from those experiences and from that good practice. And after that, we will already be at the conclusion of this day. We'll still have a discussion. So we encourage all of you to, through the chat function, to post your comments, your questions, your ideas, and we will try to pick up on all of those or most of those as the event progresses, and then culminate that in the final session today. I think, yeah, with that, I have mentioned what is happening today. We'll also continue the program tomorrow, starting again at the same time, 9 a.m. GMT, where we continue with another number of presentations, also one from DLA Piper around a guide with national regulations and legal aspects that they have set up. So that will be quite exciting. We'll hear about training programs, education and capacity building. Tomorrow we have a representative from IAPO, the International Alliance of Patients Organizations, and then also our colleagues from the SFAX Health Tech Cluster in Tunisia will present at that time to show a little bit their experience with collaboration among the various stakeholder groups that are working on and involved in eHealth development, eHealth implementation, eHealth education, and so on, and how that can be beneficial, or how such a collaboration can lead to successful eHealth implementation. With that, we're just, I guess, waiting. Kostas, I'm not sure if you've had any further news from Salim to join.
Last I heard is that he will join us in a couple of minutes, or no, not 25 past.
Okay. Otherwise, we could move ahead with already one presentation.
Let's wait a couple of minutes. But thank you for the presentation, and seems a very interesting program. It had to be shorter than what we were initially planning for a physical meeting. And this is to make sure that we all feel this fatigue of digital events, being many hours in front of the computer.
Mm-hmm. Yeah.
So we encourage you.
Maybe this is the moment indeed to say that this meeting initially was planned as a a physical meeting hosted by our partners in Ethiopia. Now, yeah, again, with the global situation, we had to change plans and turn this into a virtual event. But obviously, apart from what we're still planning as online events over the coming months, we hope to be together in different places in Africa and maybe also in Europe at certain points next year for a number of events, and also at this point, let's say an official final project event is planned for the end of next year. So we'll obviously see how things go and if and how that will work out. But again, all that information will be shared with you as things become clearer and agendas become established.
Frederic, can you resend the invitation to Salim?
Yeah, I will do so. Maybe can I eventually suggest that we give the floor? Oh, Salim is there. Perfect. This means we can give the floor. Hello, good morning, Salim. Welcome.
Hi there. Sorry, a bit late here.
No problem. No problem. We are just given the general introductions to today's event and to the project, and so we're actually ready for you to kick it off with your presentation around your activities, the WHO Digital Health Atlas.
Perfect. Okay.
So,
sorry, just coming. 2 seconds.
Yeah, sure.
No sorry problem. For being late.
No problem.
No problem.
Very good. Sorry, my camera is not working properly, but yeah, it's gonna come. There we go. Let me just share the screen quickly here.
Yeah. Okay.
There you go. So quickly here, just to want to kind of like introduce you here. So my name is Salim. Introduce myself first. Salim Azzabi. I work for the Digital Health and Innovation Department in WHO. Mainly with like the capacity building and collaboration department. And one of the products we are taking care of is like, which is like a global good provided by WHO, is the Digital Health Atlas. And the Digital Health Atlas is like kind of like a solution for a problem that actually you are trying to solve as well too, with Better Health, at least with Better Health products, is the fact that like right now there is a jungle from like the side of like digital health solutions that are in place. We don't know, like there's lots of siloed like executions, like we don't know by which like digital health solution is in place, where, and that creates actually duplication. It's like there is uncoordination, no interoperability, and what we're trying to do is to kind of like set up a solution like the Digital Health Atlas was trying to do, is to kind of solve this issue by bringing in like kind of like a platform that is like a middle platform that will like bring data to everybody, so they can kind of like decide on strategies, like try to define like what are they can do with what are the landscape, what is the landscape currently. So mainly what we do is like the Digital Health Atlas main actors are government officials, the investors, and the implementers. And the government, so the idea is to bring in all this like information from the different parties. So the information is about like projects that are running digital health solutions. So government officials need them because they need to put strategies in place and they need to know what they can leverage or other things. Donors, the same thing. They want to make smart donations. They want to invest, ensure that it's effective. They're not like reduplicating what's already done. Know about the other donors, what they're doing. And at the same time, the implementers, they want to improve health system interventions. So they want to provide with digital health solutions. They want that people know about what they're doing, and as well to be able to connect amongst each other and connect with the donors, connect with the government officials for strategies and others. So that's the idea of the Digital Health Atlas, which is like a platform in the middle between these three actors. And the idea is to make sure that like we be able to kind of go from this jungle to a garden where like actually it's out, like we define exactly, everybody talks with each other, where we map and monitor digital health implementations, where the donors are able to kind of like target the right investments. The governments are able to kind of leverage the proper digital health solutions that are in place and reuse them, avoid duplication, align with the strategy from the side of the implementers. So that's like the why of the DHA. So what is the DHA? So Digital Health Atlas is like a web tool that provides with transparent inventory of current and future projects. So the projects are accessible for governance, for like they're fully accessible and publicly accessible. It's using standardization in a way that like most of the time when we have this kind of projects in place to kind of gather landscaping, in general, what happens is like it's not standardized. Then you have different like data models used, and in this case we are standardizing, like using one model to kind of report on projects. Then it's country ownership and customization. We have like the possibility for the countries to own their data because it's their data, and they can customize it as well because they can augment like the Digital Health Atlas reporting with questions or aspects that they are specific to the country. Same for the donors. They can do the same, where they can collect valuable investment decision making like data that they want to collect. So yeah, that's the idea here, is to bring in like something that is like common, but at the same time we can extend for like specific needs. So yeah, Digital Health Atlas. So you can go to digitalhealthatlas.org. This is a quick overview. So it shows you like we have a visual here that's like the homepage where you come into a map where you can kind of browse in and then be able to select like the different projects that are in place, or like have a look at what's happening. There is different profiles that the profiles that are defined are in relation to what I just mentioned just a few minutes ago about like the different players and different stakeholders, from the donors, government users, and the implementers. And depending on like your who you are, you have like a different access to different tools. So just the simple registry of a digital health project here, you see it here quickly. There is 3 sections, which is like the general aspect, the implementation aspects, the stages where we are at, the technology used, and interoperability. This 3 parts, this five sections are the main sections of like data entry. But as I said, they can be augmented on decision of like when decided by the country or the donors, because they want specific information about specific topics. And for example, like the interoperability is something that is, for example, just to give an example here, very like important for implementers, because they want to know, what kind of products are in place, what kind of interoperability like mechanisms they have, or what kind of like standards they are using, so they can integrate with them. And then as well for decision makers, and when they do implementation, to make sure that like they scale up the right products that are interoperable, with the current ecosystem. So yeah, that's just a quick example of investors. They can just add up to and the country specific questionnaires, so that can like augment like the data entry or data form that we are providing with, that is standard. And quickly here, just to give more of a feeling of what we can do with the product, we can export, select the products that we are interested in, and then just get this information to be used outside, or you can use it for reporting or others. So that's like a simple export, but we can do something more complex with the APIs. With the APIs and others. Yeah, I'm gonna stop here. I don't want to go into a full like presentation on what it goes. The best is like I will share with you guys some links of like instructional videos, or to present how it's used and how it could be used, instead of like you know, like just playing it here. So yeah, hopefully that gives you like a good insight on what the DHA is, and then we go from here. Maybe I would prefer that we do kind of a Q&A, and then maybe a discussion around it if you need to.
Thank you very much, Salim, for this view on what you're doing with the Digital Health Atlas, and indeed it certainly corresponds with some of the things that we are doing and aiming at with the Better eHealth project. So we're very happy and very pleased to be already, well, working with you, or at least in touch with you on this, and then to see also over the next months and year how we can more closely collaborate and put two and two together, because I think in this field of eHealth, we have seen over the past years that it's really also often a matter of joining forces and avoiding to duplicate or replicate what is already out there. So that's great, and as I said, we'll obviously be closely in touch with you and your colleagues on this. Yeah, as you were talking about doing a bit of Q&A, there was already one question here in the chat around whether there is any validation or verification of projects that are self-reported in the Atlas. Is that something you can share some information on?
We don't do verification as per se, but we give a mechanism for the countries to kind of like decide if they want to verify every, so for example, like any implementer that comes into their country, they can activate that and say that like the government will need to kind of like validate or kind of vet the projects before they go into public, before they publish. So in a way that like they're still in draft mode till they move to the next stage. So we have this mechanism, but to be honest, it's not working well because it's not like something that is easy to set in place in a way that you need to have like a really very engaged governments or like actors to execute that. And moreover, like when you have a lot of projects coming in, you need to have somebody to be able to filter. So for sure, we have a mechanism in place. It's only 2 countries that are using it right now, or 3. Maximum, because of like the heavy duty of like reviewing the project each time they entered. But for sure, it's a good question, Marlon. Like your question makes sense, because for sure the problem is like we're gonna kind of start to gather data that is not relevant, or people can have fun, but at the same time, it's a public good, and then what we can do the best effort to bring in if we have a lot of like entries at one point, it's going to be most of like useful entries than non-useful entries. For sure, some the little bit of filtering needs to be happening, but that we can do it like in a way that is like from time to time, where we do kind of like a cleanup of data and make sure it happens. So we cannot be that accurate all the time, that's for sure.
Yeah, no, but and I think one of the important things here is also that at least it gives a view on certain things that are happening, that are being done, and allows stakeholders to get in touch with each other, or then to, based on what they find, for instance, in the Digital Health Atlas, or in some of the things that we will be doing within this project, to get to know of each other and about each other, and then make a direct connection. And of course, that can also provide people with more insights into what's really happening there, and whether it is useful or replicable in other situations in other countries. I'm just going to, Kostas, you were raising your hand, so please come on in.
You're on mute.
Yes. Thank you for the interesting presentation, and also I would like to also thank you for the interesting discussions we have on how we can collaborate and with the registry we are working with. I would be very interested to hear, and this would also work as a motivation for us and for the participant of our project working with the registry, if you have any experiences on how it's been already used by WHO or by the countries. And I have another question related to whether there's you see as useful to have two levels of registries, one national and one international, like the DHA, that would exchange information continuously. Do you think?
Yeah, for the use, it's definitely used like so far. Like we have some countries that are using it as their national repositories, like in a way that like they say, okay, you know, it's already available. Why are we going to create our own? Because lots of countries are already doing this, like in a small scale or whatever, like country scale. I would say small scale, it's big scale still. So we have 2 or 3 countries that are like using it as a product for them to do landscaping and make sure that like they follow up like the the evolution of like the projects within the countries. So that's one aspect. The other aspect is like we have lots of donors coming to us to like or extracting data to be able to decide on their investment strategies and others. So in a way, it's not like a direct like impact. It's always like and the product is as well. It's not like for direct impact. It's landscaping. It's for strategy making. It's for this kind of things. The other aspect that is like another value proposition we're proposing is like, as you said, we have the API. We have an API that enables like interoperability with our product. So we have some repositories that are like extracting data from the DHA and then using it for their own. So for example, like a donor could have like his own like a decision system, decision making system, and they will like just extract that like some information from the DHA to correlate between what they have and what we have, and then make a decision. So it's augmenting other repositories that are in use, and we have other repositories that are more like public repositories that are not related to digital health only, but to other aspects of like health, or that are taking this data and then bringing it to like to use for their repository. So in a way that like we are interacting, like it's kind of like not direct impact, but it's more. So this is kind of value proposition we're proposing, where we can actually like bring in the data in, bring in the data out of the DHA to others so they can consume it. And the other value proposition as well is like to make it as like a solution for others to use it as like their default solution. And one thing that is I didn't mention as well, I want to mention, is like we are interacting with other donor entities or like PEPFAR or others that they are bringing their data in the DHA. So in a way that like they have their own, as I said, like they have their own systems, but we are kind of like refining their data, or like kind of making it like simpler to bring it to the DHA. So there's in a way that like donors are trying, or other stakeholders, the key players are trying to kind of like bring in this data because they think it's important for others to bring in to kind of like bring in this data. Like the DHA is not useful if the data is not there. So by bringing the data in play, we are able to kind of bring in this view on like what could be done or not done, or what should not be done or not done, or give a better decision making for all the players. And one thing that we are working on like lately is like to put stories on the data. So right now the DHA is mainly data driven, in a way that like we have lots of data, and then okay, data is there, but it's not enough to have data. We need to create like insights. So we are launching like a product, like kind of like a sibling product coming with the DHA. That's gonna be called stories.digitalhealthatlas.org, where we're gonna kind of take this data and bring insights on kind of like insights on what the data is like, how to interpret data, or what the data is saying, and this kind of things, so people can go to it, because we realize more and more that people are not very at ease, depending on which stakeholder you're talking with. They're not very at ease with like the data only, and they might need like more of like a push into insights on what the data is mentioning there, or what are the gaps and this kind of things. So we're trying to simplify the work of like analyzing the data to players. Yeah, sorry, I went too long on this, but there we go.
Thank you very much, Salim. Actually, we have some more questions coming in, but I suggest, because we also have to keep track of time, that we will move on, but we will either offline discuss and share these questions with you, or also come back to some of these things later on in the program. But definitely thank you to our attendees for those questions around the Digital Health Atlas. So we'll definitely take this up with you. And as we mentioned, we will have further meetings and events around specific topics, and definitely Digital Health Atlas and some of what we're doing within our registries around eHealth solutions and eHealth policies will be part of that. So we'll have more and further opportunities for more discussion. So thank you again very much, Salim, for joining us here and giving that overview and introduction to the...
I will do one thing. I will just like put a link of the instructional video that would explain more for people, and then keep you there, so it's easier. Okay.
Yeah. And then we'll, as we mentioned, for those people who have put these additional questions, we will still address them in direct contact with you.
Thank you.
Okay.